welcome, and I present to you Dr. Elizabeth Sawick, our amazing, amazing director for the School of Nursing. Please take it away.
Thank you, Rana. Welcome, everyone, to this virtual graduation reception. We had so hoped to be able to actually be present with each other, but at this point, the best we can do is virtually. I want to start by actually thankfully acknowledging with gratitude the traditional, ancestral, and unceded territories on which, for the last 100 years, the School of Nursing has lived and done work, learned, and done research. These are the traditional lands of the Musqueam people, the Tsleil-Waututh, the Stolo, and the Squamish nations of the Coast Salish people. However, much of the work that UBC School of Nursing does is not just limited to the local territory and lands, but actually involves places across the province and even around the world. And so I'd like to take a moment to invite you to silently acknowledge the lands on which you're currently residing and the people with whom you've worked across the province and across the country and across the world. We appreciate their amazing resistance, resilience, and strength in the face of ongoing colonial violence. So here we are at graduation, and I am sure that, like me, there are a number of you out there who wondered if we'd actually make it this year. This has been a pretty heck of an international year of the nurse and midwife, starting out as it did with a global pandemic. At the same time, what other year would that make the most sense? A time and an event, a pandemic that needs nursing more than ever, that needs our particular skills, our knowledge of infection control, our care, our empathy, and the skills we bring at some of the most desperate times in people's lives. I can tell you that our school stepped up and has been part of the response to the pandemic, everywhere from working with government, including with WHO, on some of the public health planning, working with the local schools of nursing, as well as with our practice partners to ensure that our nursing students had safe placements and were able to step in and provide the care that's needed at a really intense time. And of course, all of you who were both working as nurses and studying and finishing your degrees and balancing that desperate challenge between school and increasing demands in your practice roles, as well as trying to do all of this while distancing, working from home, doing things virtually, taking care of family, and in some cases, actually being exposed, getting COVID, and hopefully recovering from it. Many of us have experienced loss this year, a family and colleagues and others we've known, both from the pandemic and from those other causes that are the other indirect part of a global pandemic. We have banded together in trying to survive and to cope and to contribute our expertise to supporting the health of people across the world. And it's rightfully so that so many of us in the spring, we stepped out of our doors and our balconies at 7 o'clock to cheer and bang pots and celebrate those who were working that day's shifts and those who were actually in the front lines taking care of patients and providing care in communities and doing that contact tracing that's necessary to help prevent the spread of a new novel disease. But as with all things, pandemics don't just be sort of one and done. In fact, for some of you, it may have been like your education. Seems like it's taking a long time, and it's been an intense journey. Yours, fortunately, has come to a successful conclusion. For the pandemic, we still have months, maybe even a year or more, before things are safely resolved, where we have a vaccine and where we can actually feel less careful and less concerned about infection and the transmission of this novel virus. We're in it for a marathon, and I know that the stressors that go with that have added their complexity to this year. But I do want to celebrate this major achievement that you have accomplished in such a year and recognize your graduation. As you take your new roles with your degrees in hand, you become the leaders of our future as well. You're going to be shaping what nursing does in the coming post-pandemic years, and how our new solutions forged in these really difficult months can be applied to other health issues and to other circumstances. Your grace under pressure is an inspiration to the students who come after you. And I hope that as you're now graduating to become our colleagues, you'll continue to remain in relationship with the school as clinical instructors and preceptors, as our colleagues in research, as our partners in practice. We look forward to continuing that relationship with you. Congratulations on your graduation.
We want to invite Dr. James Olson, our amazing dean for the faculty. Thank you so much for joining us. It's a really, really big honor to be able to have you here in our virtual space.
Well, thank you, Rana, and thank you, Elizabeth, for inviting me. It's a real pleasure to be here. Good afternoon, everybody. You know, as I'm reflecting on this, I keep thinking of, you know, Charles Dickens. It was the best of times, it was the worst of times as you graduate. And I guess I'll just start by saying congratulations, because in some sense this is really the best of times. And I wanted to say that how much I recognize the significance of completing your degree during this particular crisis that really underscores the vital importance of nursing. In spite of everything that's happened in 2020, you really have much to be proud of and much to celebrate. You know, this is not only your graduation, but you're graduating during the International Year of the Nurse and Midwife, and it seems very appropriate that 2020 would be such. As many might know, that I too am an alumni of UBC, and so I'm hoping that I'm really one of the very first to welcome you as a fellow alumni of UBC. And I can attest that you are now part of an amazing, vibrant, passionate, capable, and giving community that is alumni UBC. And I think that it is particularly true, maybe exceptionally true, for the alumni of this UBC School of Nursing. You have met and overcome many difficulties in these months leading to your graduation. And the lessons that you take with you will serve you well as you meet every challenge as an essential leader at the forefront of this global pandemic and beyond. Reflecting on graduating during this difficult time, I would try to offer some advice and some lessons learned. And the first would be to be nimble. You know, change is inevitable. Sometimes it's hard to accept, but don't rest on routine and convention. Be ready to assess, evaluate, negotiate fitting responses to these very unprecedented situations. You've already shown that you are, but to be resilient. Acknowledge that when everything you prepared for has been overturned, recenter and start again. It's that grit and determination that will carry you through. Be present and curious. The moment never comes again, and there are lessons to be learned from it, no matter what it looks like. Be prepared. The world we are living in is one of upheaval and change, but also an opportunity. Look for the places where your particular insight will make a difference and step in. I know that you know all of this and more. You've demonstrated knowledge and experience, and resilience will bolster your vision and courage and make your leadership formidable, not only in this watershed moment, but throughout your entire career. As your lives grow ever busier and your career takes off to new heights and different directions, I hope you'll take the time to remember where it all began. Please continue to engage with and contribute to the School of Nursing. And one day, I am very confident at either an event at the School of Nursing or another event hosted by the faculty that I will have the opportunity to toast your success in person. And until then, I would just wish you a very warm congratulations on this day. And I'll turn it back to you, Elizabeth, I think.
Thanks, James. So normally in a regular graduation year, we would have that opportunity to march across the stage in the Chan Center and have everyone named. But in these times, the graduation that'll happen shortly won't have that opportunity to name everyone. So we thought we'd take an opportunity during the reception to provide some of the graduate, that same kind of a sense. And that is, we'll be naming all of you and recognizing your achievement. First, for the Masters of Nursing and nurse practitioners, I'd like to congratulate Priya Baines, whose culminating project was screening older adult men for abdominal aortic aneurysm, a scoping review. Congratulations, Priya. Alexander Raymond Breed, whose culminating project was an examination of barriers and facilitators to the incorporation of ultrasound training into nurse practitioner programs. Congratulations, Alexander. To Jamie Michelle Burgoyne, whose culminating project was the use of simulation in nurse practitioner programs to enhance clinical readiness in practicum settings, a scoping review. Congratulations, Jamie. Mara De La Rosa, whose culminating project was deprescribing in older adults with polypharmacy in primary care, evaluating the current practices and development of a decision support tool for nurse practitioners. Congratulations, Mara. Jennifer De Medeiros, whose culminating project was fertility preservation amongst transgender and non-binary youth in the primary care setting. Congratulations, Jennifer. NAVDEEP KAUR DHILLON, whose culminating project was bridging barriers to cervical cancer screening in transgender men, a scoping review. Congratulations, NAVDEEP. Angelica Sheila Drazgowski, whose culminating project is What is a Nurse Practitioner? Role Confusion within British Columbia. Congratulations, Angelica. Jan Dustin David Gopez, whose culminating project was e-cigarette or vaping product use associated lung injury, a scoping review. Congratulations, Jan. Michael Gozal, whose culminating project, Emergency Department Overcrowding, a multifactorial problem, optimizing NPs within the emergency department to improve flow and limit congestion. Congratulations, Michael. Pardeep Kaur Gruel, whose culminating project was Clinical Pathways in Pediatric Hospital Settings, an integrative review. Congratulations, Pardeep. Karina Gurdzian, whose culminating project was Exercise in the Postpartum Period, Recommendations for Nurse Practitioners. Congratulations, Karina. Shane Edward Inocencio, whose culminating project was Exploring the Possibilities, the Utilization and Integration of Nurse Practitioners within Hospital Medicine in British Columbia. Congratulations, Shane. Farima Karimi, whose culminating project, Male BCRCA 1 or 2 Carriers, a Scoping Review. Congratulations, Farima. Susanna Elizabeth Kreutzer, whose culminating project, Type 2 Diabetes Nutrition Counseling, a Literature Review. Congratulations, Susanna. Whitney Michelle Kroll, whose culminating project was Managing the Health of Women After Spontaneous Coronary Dissection, Special Considerations for Nurse Practitioners. Congratulations, Whitney. Alyssa Kelsey Laserson, whose culminating project was HPV Vaccine in College-Age Men, a Scoping Review. Congratulations, Alyssa. Jeanette Chu Liang, whose culminating project, Infant Feeding Practices, Mode of Feeding and Associated Infant Health Outcomes. Congratulations, Jeanette. Amy Lowe, whose culminating project was Virtual Visits in Primary Care, a Scoping Review to guide nurse practitioners' practice. Congratulations, Amy. Jenna McClellan, whose culminating project was Transitioning Patients Undergoing Total Mastectomies to Primary Care. Congratulations, Jenna. Noreen Kaur Molly, whose culminating project, Male Perpetration of Adolescent Dating Violence. Congratulations, Noreen. Tamana Nabizada, culminating project, An Approach to Adult Obesity in Primary Care. Congratulations, Tamana. Paul Rajan Singh Pada, whose culminating project was Muscle Dysmorphia in Men. Congratulations, Paul. Chi Wei Pan, whose culminating project, Factors Influencing Human Papillomavirus Vaccination Decision-Making in Immigrant Parents, How Nurse Practitioners Can Address Immigrant Parents' HPV Vaccine Hesitancy Using the Health Belief Model. Congratulations, Chi Wei. Chantal Mary Peterson, whose culminating project was Assessing Health Inequities and Associated Health Outcomes in Refugee Women in the Prenatal Period in Canada, a Scoping Review. Congratulations, Chantal. Monica Sleskowitz, culminating project, Improving Outcomes for Patients with Delirium After Cardiac Surgery, Review of Current Literature and Recommendations for Nurse Practitioners. Congratulations, Monica. Lawrence Edward Toulousan, whose culminating project was Diet Modification and Physical Activity as a Prescription to Reduce Frailty. Congratulations, Lawrence. Patrick Ray Teodosio, whose culminating project was Business Knowledge Education for the British Columbia Nurse Practitioner, a Scoping Review. Congratulations, Patrick. Melissa Tilley, whose culminating project was Continuing Medical Education Needs of Canadian Nurse Practitioners, a Scoping Review. Congratulations, Melissa. Manraj Kaur, culminating project was Medical Assistance in Dying in Canada, a current review of its implications for nurse practitioners. Congratulations, Manraj. Nadia Wint, whose culminating project was Motivational Interviewing in the Management of Type 2 Diabetes. Congratulations, Nadia. Now I'd like to congratulate those who are the degree holders of the Masters of Public Health and the Masters of Science in Nursing dual degree. Patrice Wright, whose thesis was The Intersection of Stigma and Inequity, the Impact of Structural Violence on People with Lived and Living Experience of Substance Use and Homelessness in the Emergency Department. Congratulations, Patrice. And now for the degree of Masters of Science of Nursing. Lindsay Ann Bendixson, whose thesis is Poverty, Parental Depression, Parental Self-Efficacy, Social Support, and the Home Learning Environment of Toddlers, an application of the Family Stress Model. Congratulations, Lindsay. Catherine Cairns, whose thesis was the characteristics of complex adaptive systems in technology-mediated wound care communication processes. Congratulations, Catherine. Miranda Cavanagh, who completed a SPAR, Clinical Signs and Symptoms of Neonatal Sepsis in Low and Middle Income Countries, an Integrative Literature Review. I'd like to take the opportunity to invite Miranda to contribute her statement.
Thank you very much. It's nice to see everybody and congratulations. Well, I think my words are written there, but just reflecting back on my graduate educational journey, I really consider the strength and perseverance it required to be here, but also the tremendous growth that came with it. And while I could focus solely on my education, it really gave me the structure and encouraged me forward when I needed it the most. And really, I feel very privileged for the opportunity to complete graduate education. And I am really thankful for those who supported me along the way. And congratulations to all of my peers.
Thanks, Miranda, and congratulations to you. Ramandeep Kaur Dada, whose SPAR was Exploring Nursing Scopes of Practice of Registered Nurses and Licensed Practical Nurses, a focused literature review. Congratulations, Ramandeep. Caitlin Louise Ellis, whose thesis is The Characteristics of Medication Administration Incidents Involving Bachelor of Science in Nursing Students During Clinical Practice Education. Congratulations, Caitlin. Jessica Grant, whose SPAR is Nurturing the Psychological Health and Safety of the Nurse Manager, Creating a Support Group. Congratulations, Jessica. Andrea Jennifer Greene, whose SPAR was the use of Canadian C-spine rule by emergency department nurses. I'm sorry, C-spine rule by emergency department nurses. Congratulations, Andrea. Anna Kuznetsova, whose SPAR was nursing role in central line management across pediatric critical care settings, a scoping review. Congratulations, Anna. Derek Kai-Ming Lee, whose SPAR was Collaborative Approaches to Clinical Practice Education in Schools of Nursing, a scoping review. Congratulations, Derek. VEENA Claudia MUDALAIR, whose thesis is Exploring the Southern Dalka First Nations Youth's Experience of Wellness. Congratulations, VEENA. Randall Alexandra Tidwhiting, whose SPAR Engage, Creating a Framework for Patient and Family Engagement for a Healthcare Organization. Congratulations, Randall. Pearl Van Dyck, whose SPAR was Fertility Preservation in Women Diagnosed with Cancer, a proposal for a nursing competency framework. Congratulations, Pearl. Now I would like to turn to the degrees, the PhD. Dr. Nassam Adami, whose dissertation was Shining Light on the Complexity of Cardiac Rehabilitation Utilization by Patients with Heart Disease. Congratulations, Dr. Adami. Next, we have Dr. Shelley Elizabeth Canning, whose dissertation, Understanding the Experience of Emotional and Social Engagement for People with Advanced Dementia Living in Long-Term Care. Congratulations, Dr. Canning. And I'd like to invite you to share your remarks at this point.
Hi, I just want to say congratulations to everyone there and to thank everyone at the School of Nursing for making this special. It is such a meaningful thing. I know it is for me, and it will be for everyone there. I've come to UBC School of Nursing 3 times now to get a degree. And for all of you who perhaps haven't had that 3 times experience, each time I've come, I have left with a much clearer sense of what it means to be a nurse, what it means to make a difference, and really a better sense of myself. And that's saying a lot because my experience has spanned several decades. I couldn't have done it without the support of a fantastic group of faculty there, Dr. Allison Finney and Dr. Sally Thorne. So I really just can't say any more than thank you so much. It's been life-changing. And for all the brand new nurses out there, there's a reason to be proud. There's a reason to keep going, and it will be life-changing, and you'll find that as you roll through. So thanks very much.
Thank you, Dr. Canning, and congratulations. And last, but definitely not least, Dr. Jae-Young Kwon, whose dissertation was The Utility of Atrial Fibrillation Clinical Registry Data in the Modeling of Change in Patient-Reported Outcomes. Congratulations, Dr. Kwon. Congratulations to all of the graduates this year, and best of luck in your career going forward. Back to you, Rana.
Thank you, Dr. Sawick, and thank you, Dean Olson, and thank you to all the graduates. Congratulations. Next up, we have Dr. Allison Finney to present our amazing awards for our classes and outstanding projects.
Thank you very much, Rana. And I just must say my own congratulations to all of you. Hearing the titles of all of those projects is just, it does my heart good. And I thank you all for your contributions to nursing in creating all of this new knowledge. We have some important awards coming up, and I'm just going to, I think there's a slide thing, Rana. Here we go. First, I would like to congratulate ANDREA GREENE, who is the recipient of the University of BC Nursing Division Golden Jubilee Scholarship. This scholarship is awarded to the top student in the final year of the MSN nursing program. And as you can see, it's made on the recommendation of the director, and it's given by the nursing division of the UBC Alumni Association. So congratulations, Andrea, for being awarded this, for being the top student in our MSN nursing program this year. Next. And next, congratulations to Priya Baines, who is the recipient of the School of Nursing. It says Outstanding MNNP. This is the award for the top graduate in the MNNP program. And again, a scholarship of $1,250 is awarded to the student in the nurse practitioner program with the highest academic achievements in the graduating class. Congratulations, Priya. And congratulations to NAVDEEP KAUR DHILLON, who was nominated by supervisors Dr. John Olaf and Dr. Jennifer Christ for her outstanding culminating project. This is given in recognition of an outstanding scholarly practice advancement research, what we in the School of Nursing call a SPAR project, completed in Nursing 595. This is recognizing projects that are outstanding in terms of their originality, scope, and relevance. Congratulations, Nav. And I just realized, can you back the slide up there? Is it Rana? Outstanding culminating project. The text here is incorrect. This is for the culminating project in the nurse practitioner program, not the SPAR. So ignore everything I just said. But what is true is that this was a culminating project in the NP program that was considered outstanding in terms of its originality, scope, and relevance. And again, congratulations. And my apologies for the error. So let's move forward. For Miranda Cavanagh, congratulations for winning the award for outstanding, this is for the outstanding SPAR, the Scholarly Practice Advancement Research Project. Again, recognized for your work that was considered by your supervisors, Dr. Manon Ranger and Dr. Leanne Curry, as being outstanding in terms of its originality, scope, and relevance. Congratulations, Miranda. And VEENA CLAUDIA MUDALAIR, who has received the award for outstanding thesis. Again, considered outstanding and nominated by your supervisors, Dr. Sabrina Wong and Dr. Vicky Bungay, for work that is outstanding in terms of its originality, scope, and relevance. Congratulations, VEENA. Oh, and this one, I have to say, is particularly special for me, recognizing Dr. Shelley Canning for an outstanding dissertation. This was nominated by myself and Dr. Sally Thorne, recognized for a graduate of the doctoral program for having completed outstanding dissertation research, outstanding in terms of its originality, scope, and relevance. Congratulations, Shelley. And I believe that's it. I'm going to hand it off. We have some comments and congratulations from faculty. So take it away.
Thank you, everyone. Thank you, Dr. Finney. Emily's going to share a video from our amazing NP faculty who are all actually, except for Dr. Christ, who was able to be here, and we're so thankful for that, conducting some educational evaluation assessments for our future NPs, but they wanted to make sure to send.
Hello, my name is Scarlett McQuaig. I'm an assistant professor of teaching and the coordinator of the Master's of Nursing Nurse Practitioner program at UBC. I'd like to take this time to congratulate you on this very, very special day. You have all demonstrated so much resilience during these unprecedented times, but just know that the skills that you've learned will serve you well in your future NP practice. The NP faculty and I have decided to share some of our pearls for future NP practice. So I'll start off. So my pearl to you is, even though you feel extremely anxious during your first job as an NP, just keep going. The more you go, the better you'll do. That's why they call it a practice. So congratulations to all of you. And I just know that you'll shine out there during your NP practice.
Hi everybody, my name is Jill Harding and I'm a lecturer in the nurse practitioner program, and I just want to say congratulations, and I wish I could be there to celebrate with you all in person, but I just wanted to take a moment to say how proud of you I am, and to give you a little piece of wisdom, which is that you guys, if you feel like you don't know what a patient presents with, you guys know what's normal and you know what's abnormal. So pay attention to your intuition, pay attention to what your gut's telling you. If it feels like something is not right, look it up, talk to your colleagues. You guys have got this. I know it may not feel like it, but you've got this. And I can't wait to see you all out there in practice. And I look forward to working together as NP colleagues. And maybe one day you'll be back to UBC to pursue your doctoral education. And I'll see you then.
Hi everybody, it's Jenny Christ here. I'm also a lecturer with the UBC Nurse Practitioner Program, and I am also so proud of you all, and congratulations to your 2020 graduation, and we just so wish we could be there with you in person celebrating. We are your biggest champions, so good luck to all of you. And if I could look for some pearls of wisdom, oh my goodness, I have a couple here. So what I always tell my children is always try your best, and take care of the caregiver, because that's so important, especially today. And then one of my favorites from Brene Brown is, when we have the courage to walk our own story, own it, then we get to write the ending. So congrats to you all, and I can't wait to see you all soon.
Hi everybody, I'm Shannon Rooney, also NP faculty here at UBC. Congratulations, my goodness, what a year to graduate from a master's program. My advice would be that it's normal to feel overwhelmed, and just don't be afraid to ask questions. And congratulations.
Hi everybody, my name's Marilyn Burrows. I'm also the fourth, fifth lecturer in the NP program. We keep changing, can't keep track. So yeah, congratulations. Yeah, a crazy year to graduate. You will definitely be our first class ever to graduate with, the claim to fame of graduating during a worldwide pandemic. So as Frela said, the perseverance that you've shown throughout this last 2 years, especially over the, well, since March, will really help you in your future practice. And then in terms of Pearl, I think I would just encourage you guys to all stay connected. I know you guys are really good with using your WhatsApp and whatever groups to text each other, ask each other clinical questions, and keep that up, because you guys will all be going off to different types of practices, and having somebody that works in maternity or cardiac or primary care, you guys will all be leaning on each other to get through everything. So good luck.
Congratulations, everyone.
See you soon.
We also have messages from Dr. Susan Hinton and Dr. Maura McPhee, who are the graduate advisors for our master's and doctoral level students. But this is the portion of the event that we really, really want to take some time. And we want to stop congratulating you, and we want to open up our virtual spaces and living rooms and homes and wherever we're calling in from to you, for you to be able to make any remarks to the reception that you wish. So Emily's helping me out with this. If you just want to raise your hand, and I can't actually see the participants. Actually, you know what, I'm going to fix that. So I'll just stop sharing the PowerPoint because I don't need to do that. And then I can actually see who raises their hand. So if you'd wish to speak, please raise your hands. And if you're comfortable, turn on your camera, and definitely turn on your mic so we can hear your beautiful voice and the message that you want to share. But this is also completely share if you're comfortable. You're welcome to continue to share your wonderful messages in the chat. This is totally not mandatory warm fuzzy sharing time, but we would love to hear from you.
Hey, Rana.
Yes.
While we're waiting, if anyone wants to say anything, I just want to say one thing. My favorite thing about graduation as a faculty member is the great seat that I get, because I get to sit on the stage and I get to look out at everyone, and it's almost as good seeing your faces and your names here. But my really favorite part is looking out and seeing all the families and friends, and it always makes me cry, because I realize that, you know, that thing about it takes a village, it really does take a village. So if there are any families, friends, I know there's some kids out there, congratulations to you all. And I hope you give your person a really big hug and treat them really well, because they worked really, really hard. But I also recognize the work that families do to get everyone here to this place today. So congratulations to all the family and friends. That's all I want to say.
Thank you, Dr. Finney. Definitely congratulations. And looking at the time and knowing that we have a few more minutes, but we also want to make sure that you have an opportunity to enjoy the time that you have to celebrate this accomplishment. We want to remind you that there is a beautiful ceremony planned by our amazing, amazing counterparts in the ceremonies office. The pre-show starts at 2:30. The formal celebration starts at 3 p.m. And we hope that you're able to also watch that live stream too. But President Ono has promised that UBC will celebrate once this is all over and we are allowed to do it in person. And the School of Nursing will also figure out how to make sure that we can have the old kind of receptions that we used to have, because those were really, really fun, both to plan and not. So that is kind of the programmed portion of the event. I'm going to stop sharing my screen. Continue to feel free to stay for as long as you'd like to stay. And now it is just the informal part, where in the old reception, you would have been walking around and, you know, you'd have a tray of food. I'm sorry, Emily and I can't provide that for you today, but feel free to enjoy, and congratulations. And thank you for joining our program today.